There we go. Hello and welcome. So glad to have you with me tonight. We are going to have some good times tonight talking about pupils. We're going to learn a couple of basic pupil indicators tonight. Just before we get going, I would like to know if you have a background in iridology. Have you studied iridology? If you have, drop a comment in the chat box and let me know. If you're brand new to iridology, I would also like to know that. So let me know where you're at with iridology. You've got some training, maybe you've got a little bit of training, maybe you're brand new. Let me know. That's going to help me gauge where I need to aim my comments and my teaching tonight and how I need to shape it to be really good for you. Okay, are we good? Sharon says she's watched a couple of my videos. So you've dipped your toes in. That's great. I'm glad. So glad. All right. So just a quick question. What has been your biggest obstacle to learning iridology at a professional level? Any of you want to be a little brave and share with me on that one? That really helps me as well because, if I know that most of your training is from books or from random YouTube videos, that's going to be very informative for me. I've been teaching these mini classes for many years now, and some of you I know through my Facebook group, the Dynamic Iridology Assessment System for Health Professionals. So that's another great way to kind of keep in touch with me. But this is huge, often an issue that people have a problem finding a good enough course that they want to enroll in. A course good enough for them to want to spend their money and their time in, right? So hopefully what you'll see here today is something that will catch your attention and will inspire you to join me for a course. This is what one of my students said. And this is Trisha Calsto. She is an iridologist and an NHCP. I just wanted to say, as a new student who has worked in iridology before this and is a certified iridologist through another teacher, I've learned more in the first 2 lessons of your dynamic iridology course than in all my previous iridology training. That's a little bit scary. I'm excited that she felt that way, but it's a little scary that somebody else certified her with less information than 2 lessons from me. I'm so glad that I decided to sign up. I know that after taking this course, I will be able to offer my clients the best and most up-to-date knowledge. So very cool. So the information that we're doing tonight that I'm sharing with you is only meant for your education. It's not meant for you to diagnose or prescribe. You are responsible for any results you get from using this information. That's just how it is. Okay, let's start talking. So when we do iridology, we look at the iris, we look at the sclera, and we look at the pupil. We look at all 3 parts of the eye. Each part gives us a different layer of information. So it's important that we have all 3 parts. When I first started doing iridology, learning it 45 years ago, we only looked at the iris. We didn't look at anything else. We thought the iris held all the clues we needed. And over years, we've discovered that a lot of what we knew back then wasn't quite right. And that, oh my goodness, the pupil has information and so does the sclera. So are you ready to start learning a little bit about the pupils? If you are, let me know in the chat box. Yes, fantastic, Sharon. I'm glad you're awake with me, Sharon. Good job, thank you. Okay, so the first thing we're going to learn is called meiosis. Now, one of the big things that has happened with iridology in the last about 30 years is we've stopped using made-up words and we are using words that are ophthalmologically correct, right? And it's not that we are diagnosing with these, but the ophthalmologists and the optometrists, all of the eye specialists, have words that they use to describe what they're seeing. And we are adopting those words. And it's just such a wonderful thing to be getting caught up the way we should be. So when we are looking at meiosis, we are looking at someone whose pupils are very small. Now I'm going to put you on the spot here. Why can we not diagnose meiosis properly from a photograph? Why do you think that is a mistake? This is exactly how I teach my classes. I make my students think. Why do you think lighting? What about lighting, Sharon? You are totally on the right track. What about lighting? Yes, I'm going to hold Sharon's feet to the fire. Just going to get them pretty warm tonight. What about lighting, Sharon? What makes the difference? Bright light will change how it appears. Yeah. And specifically, the brighter the light, the smaller the pupil, right? We know that if you see someone and they're outside in really bright light, the pupil gets really small. The body is smart. It goes, that light is going to hurt my eyes if I leave my pupils wide open. So I'm going to shut the pupils down as tight as I can. So we always want to be assessing meiosis in natural room lighting. Of course, we can't do that right now. You can't see me well enough to see my pupils, and I certainly can't see your pupils. So we really need to, we just practice on photos, but in clinical work, we want to look at the pupil's face. Meiosis is an indication that either bright light or that the person's looking at something that they really don't want to see, or the bigger reason is it's a parasympathetic nervous system response. This is someone who likes to stay relaxed. They like to keep control of their world. And as long as their world is controlled, they are happy. They don't do chaos well. And for them, chaos is somebody put the bayberry on the herb shelf where the paprika is supposed to go. That is enough to be chaos for people who have meiosis. Do you know anyone like that? Who, as long as all the ducks are in a row, as long as all the waves are patted down on the ocean, they are fine. But the moment there's a little bit of a wrench in the works, they kind of don't handle it well. Yes, Sharon knows someone like that. Yeah, that is your person who has meiosis. Here's another beautiful example of meiosis. Again, we're considering what is the lighting. This camera is throwing a lot of light on these eyes. So it's not, wouldn't be correct in a clinical setting to call these eyes miotic, but certainly in a normal room lighting, if we saw these pupils being this small, we would be wondering about how relaxed they are and how much they want to keep their world totally under control. When we're doing photographs of dark eyes, we need to use a slower shutter speed. We need more light to actually hit the eye. And we're talking like milliseconds here. And that will allow us to see more details in the iris, but it also means that there is that millisecond more of light hitting the eye, which means the pupil will be contracted. So always look in normal lighting when you're assessing the pupil size. So I want you to think back. I'm hoping that you've all got some anatomy and physiology under your belt. Think back into your studies of anatomy and physiology and think about the kinds of things that being parasympathetic dominant could affect. And think about how, if this person's world isn't lined up just perfectly, how would the parasympathetic system get knocked out of balance? And what kinds of symptoms might we see? What do you have for ideas? If someone is easily stressed when they're not in control of their world, what kind of symptoms, physical or mental, emotional, might we see? Elizabeth says everything. That's a cheat answer, Elizabeth. Just saying, that's a cheat answer, right? We want to make sure we are absolutely paying attention to all the things that could be going on here. Yeah, I think of things like digestion, poor gut health. Yes, Elizabeth, we're on the same wavelength. Good job. I think about digestion, right? How many people do you know that when they're upset, they can't eat? They just simply can't eat. They feel nauseous. Their whole abdomen feels tight, and they just can't do it. They can't eat, right? That would be one. Sleep. How many people don't sleep well when their world is upset? How many people get grouchy, grumpy, irritable? Right? Do you know anybody like this? As you're looking at these eyes, I want you to think about people you know who fit into these categories. Now, let's look at the extreme other end here. This is mydriasis. This is the enlarged pupil. Now, typically, this happens when someone is in the sympathetic nervous system. Now, let's kind of take a broader scope of this for a moment, though, because children typically have mydriatic pupils. Their pupils tend to be large. And they may be functioning in the sympathetic system because everything around them is new. Everything is a new experience. They don't know what to expect next. And so that can be a truth. Hopefully, they're in a protected and supported, safe environment so that all these new experiences are not overwhelming or harming for them. The large pupils of the mydriatic eye will also reflect that we have dimmer light. When we are working with someone who has mydriatic eyes, mydriatic pupils, we are going to need to be very careful with the lighting we use on our camera. Our cameras tend to be quite bright. And if we're shining that bright light right in their eyes and then we're flashing at them as well, it can be very uncomfortable for them. So we need to be a little bit cautious and a little bit careful when we're doing photographs, eye photos of people who have mydriatic eye pupils. So sympathetic nervous system. Who remembers what the sympathetic nervous system does? The parasympathetic was rest, digest, and sex. What is the sympathetic? Fight or flight. Yes, Elizabeth. Yes, very good. Fight or flight. We have now added freeze and fawn to the list of mydriatic tendencies. So there's some reasons for this. Our pupils get big when we are under stress, when we think there's a bear chasing us. And so if our pupils are big, our peripheral vision increases and we don't have to turn our head quite so far around to see how far behind us that bear is. I don't think I would be turning to look. Honestly, I don't, because I don't think I could outrun a bear anyways. I would probably just be on my knees praying or something like that, at any rate. So when we've got someone who lives in the sympathetic nervous system, what kinds of health tendencies might we see there on an ongoing basis? Any ideas? If you've got someone who's always in fight or flight, they're always at the edge of fight or flight, what are we going to see? Oh, yeah, you could see IBS, Stacy. Absolutely. There's other markers in the eye that will give us even more clues as to the risk of IBS. We could see IBS. Any other ideas? I love the interactions that you're doing in the chat box. This is so good. And let that one just hang there for a bit. Did you know that your pupils also get bigger when you're looking at someone you love or looking at something that you really appreciate that's really beautiful? So when you're looking at your sweetheart or you're looking at a new baby, your pupils will get bigger. It's almost as if your body is saying, and your nervous system is saying, I want to take in more of this. I'm enjoying this. Very cool, right? Very cool. Not quite as mydriatic, but slightly. So again, when we see these mydriatic pupils, this is someone who is always waiting for the next crisis. They're on edge, waiting for the next shoe to drop. They're waiting for the next bomb to go off. They're waiting for their partner to yell at them. They're waiting for their boss to say something mean and nasty. They're waiting for someone to cut them off in traffic. They're not feeling like they're always in a safe place. And they're always prepped for fight, flight, freeze, or fawn. They're always ready to slug that person, to deck them, and not that they necessarily would, but that's the emotion they feel when something is not quite the way they want it to be. All right, we're going to take a little commercial pause here. Actually, not really. I've been with you a few times. Some of you are very familiar to me. Some of you are quite new to me. My name is Judith Cobb, and so I'd like to just take a moment to introduce myself to you to help you see why paying attention to what I'm teaching might be a good idea. I got started in holistic healing back in 1979, and I started doing clinical work in 1981. And in that clinical work, it included herbology, nutrition, and iridology as we knew it back then. Since then, I've studied iridology under 8 different teachers, 3 different styles. I am one of only 10 level 3 certified IPA iridology instructors in the world. I was one of the first 3. Over the years, I've written all kinds of books that were self-published and self-distributed, and they're all out of print now, except for the textbook we use for the dynamic iridology class. I've written books on pregnancy, on children and herbs. I've written books on biokinesiology and color therapy. And then, of course, the dynamic iridology textbook. I've created and taught many different classes, from practical use of herb classes to prenatal classes. I was a certified prenatal educator for a while. That was a lot of fun. And certainly now I'm focusing mostly on teaching iridology and teaching iridology integrated with herbology to my advanced students. So stay with me to the end of today, and we'll talk a little bit about the dynamic iridology assessment system course. These are all my creds that you're seeing on the screen here, things like certified level 3 iridologist, certified level 3 iridology instructor. IPA makes us update our credentials every 2 years, and they issue the badges every 2 years. So I've got more badges than this, but there's not enough room for them. I have just recently, even though I've been teaching for years, I decided finally to take the leap and become a sanctioned school through IPA. So my course is now a sanctioned course. It always has been approved by IPA, but now as a sanctioned school, it carries a little more weight. In 2022, I was presented the Instructor of the Year Award from IPA. And in 2024, I was presented the Iridologist of the Year Award. I was pretty pleased with those, totally stunned and surprised that I was considered for either of them. I'm also a professional member of the Canadian Association of Holistic Nutrition Professionals and the Canadian Association of Natural Nutritional Practitioners, and I'm a professional member of the Alberta Herbalist Association. So lots of creds behind me, and I draw on all of my training to teach my courses, to give my students the very best of everything I have to offer, and the best of 45 years of experience as well. All right, let's look at some more eyes. All right, and I want you to feel free to lob questions out about what we're learning. Just throw them in the chat box and we'll address them as we can. When you look at this eye, can you see that the pupil is not round? And can you see that it has a bit of a lean to it? Look at it really closely. That looks like a death eye. Stacy, I'm not sure what that means, a death eye. That's a term I've never heard before. Help me understand. When we have a pupil that is not round, it's more of an ellipse, and it can be tipped in any direction. It can be vertical, horizontal, or at an angle. This tells us that there could be some risks here. So Stacy says, looking at someone who is passing away or near to, no, this person is definitely not. Definitely type 2 diabetic, but definitely not near passing away. All right, so I'm not sure what you look for if you're calling it a death eye. I know what I look for as an iridologist, and this is not that. So with this, again, depending on which eye we are looking at and what direction the ellipse is pointing, but particularly if it's on an angle, it suggests an increased risk of bronchial issues, among possibly other things. So we do need to know which eye we're looking at we need to know what angle that ellipse is sitting on in order to understand where the risks are. Sometimes, depending on that position, it can suggest pressure on the lungs and heart. Sometimes it can suggest pressure on the brain and kidneys. Oftentimes it'll be on the angle and it will be more about a respiratory or a bronchial challenge. Here's another ellipse. You can see it is slightly angled, pointing off, and this is her. I always have to cross my arms to remember. I get my lefts and rights mixed up still after 45 years. Left eye. So this is pointing up to her left. And when we see that ellipse pointing up and to the left, it is telling us that we've possibly got, again, that risk of respiratory kinds of things like a nervous asthma situation. If both of her pupils have that kind of an angle, that is going to suggest that we've got some other things possibly happening, including potentially some lack of strength happening in her legs, some lack of nerve feed and lack of circulation getting there. We don't have her other eye here, so we can't ask her questions about that. It's really important that we remember when we're doing an iris assessment, and that includes pupils and sclera, that we never make pronouncements. We never say, oh, you have this problem. We can say your pupil is an ellipse and it's pointing up and to the left. That suggests there may be challenges with nervous asthma. Is there any personal or family history of respiratory issues? Right? Flattenings. Sometimes we will see that pupils have flattenings. Can you see on this pupil how the top looks like it got squished? And this bottom, this is the inferior medial side of the right pupil, looks like it got squished too. If you can see that, give me squished in the comments box. Can you see squished? Squished. Yes, Sharon. Good eyes. Awesome. Fantastic. When we see flattened aspects, each of the different aspects, whether it's superior medial or inferior medial, any of these aspects gives us different information about where there could be subluxations in the spine. And of course, if there are subluxations, there will be some kind of interruption in the nerve feed from the nerves coming off the spine and going back into the spine. So in this particular case, with the flattenings being at the top of the eye, and it really doesn't matter in this case which eye, because if it's the top, it's the top. That is telling us that we've got a tendency towards depression, fatigue, paranoia, melancholy, and guilt feelings. Now, would I ever say to a client, I think you have depression? No, I would not. I am not licensed to say things like that. But as we're talking, I might get a feeling that this client has depression. So I might ask in a very gentle and broad way, has anyone ever suggested that there might be some depressive tendencies going on? And virtually every time they'll say, oh yeah, right? And so I've asked it, but I haven't told them they have it. They've told me they've had a diagnosis. When we look at this inferior medial part, again, this is on a right iris. Inferior medial correlates to the sacral lumbar area of the spine. So we might see some subluxations in that very lower back. We might see, because of that, some genitourinary disturbances. And again, this is looking at the L1 through L5 vertebrae. And so, again, we would ask, have you ever had any problems with your lower spine? Do you work with a chiropractor or an osteopath or someone who does spinal work? And do they tend to spend a lot of time working on your low back? And if the answers are, oh yeah, I go like every month or every 2 weeks, and yep, they're always working on my low spine, we know that that is exactly why we've got a flattening here, right? And then we need to be recommending that the client maybe add to their chiropractic work some strengthening work for that lower spine to begin holding the spine in better positioning, right? Here again, we've got lateral and medial inferior flattenings. Now, this is interesting. This is a young lady who came to me at about the age of 22. She had all the symptoms of PCOS, but had not been diagnosed yet. The classic indicator of PCOS is menstrual cycles that are routinely more than 6 weeks apart. Hers tended to be 7 to 8 weeks apart, and she was gaining weight. The doctor had told her, hadn't called it PCOS, which I think was maybe an error on his part. He had said she was postmenopausal. And of course, PCOS, the hormones, depending on where in the cycle those labs are taken, can look postmenopausal. So the doctor didn't stop to find out diet and lifestyle, which is what we did in an effort to stop the weight gain and maybe ultimately restore those menstrual cycles. All right, so as we look at her eyes and we see that she has flattening, again, inferior medial and inferior lateral. When we see the flattening here, we have an impact on the pancreas and the liver. How involved are the pancreas and the liver in balancing blood sugars and in balancing hormones? What do you think? How important are pancreas and liver together in balancing blood sugar and balancing hormones? Is that a fairly important? Yeah, Elizabeth's saying super important. Absolutely. Absolutely. I'm hoping everybody's agreeing with what Elizabeth said there because she's absolutely spot on. And Sharon says, yes, good job, Sharon. When we look at the flattening on the lateral, or sorry, I got those backwards. Inferior medial, no, is pancreas, liver. Inferior lateral is ovary. So now if we've got liver and pancreas not wanting to balance blood sugars properly and probably not balance hormones, what impact will that have on an ovary that already is having some issues with the nerve feed from the spine? Is it likely that all of these nerve feeds are going to play together in the sandbox and cause a problem? I think so. Big struggles. Sharon, good way of describing it. Big struggles. Big struggles. And in a case like that, the first thing that has to happen is the diet has to be fixed, right? Diet has to be fixed. And then we need to do organ support with herbs and foods as well as we can. More flattenings. So this is a client who's been with me from the very beginning. She's been with me for 4.5 decades. She's just a couple of years older than I am. Last time we got together for an appointment, we were chuckling about the first time we met and which of our babies we had in car seats, right? And because we both had little tiny babies when we met for the very first time. Notice that in her right eye, she's got a superior lateral flattening. And notice in her left eye, she has a superior medial flattening and an inferior medial flattening. These three areas all reflect pancreas. So a little bit about her story. Again, we've worked together off and on for about 45 years. And on this most recent set of appointments we were doing, she was coming in because here she was, mid-60s, and a little bit afraid of what was happening with her health. She'd been to the doctor. She'd had a bunch of labs done. Her A1C was elevated, as were her triglycerides and cholesterol. Anyone see a problem with elevated A1C, triglycerides, and cholesterol? If you had to pack those all together, what kind of a health concern would you say she has? There's a few of them. Where do you think you'd land? With elevated A1C, triglycerides, and cholesterol all being elevated. What are some things that you think her doctor might have said are not right? What disease names, not that we diagnose disease, but what do you think her doctor would have said? What's your best guess? She was also about 30 pounds overweight. That might give you even more clues. Any ideas? So we know her pancreas is not happy. She also, we're going to go a little bit deeper than pupils here. Stacy's saying inflammation. Yeah, she's going to have inflammation. That's for sure. Absolutely. Good job. Sharon says diabetic. Yeah. Yeah. Pushing her towards type 2 diabetic. Hypothyroid. Maybe, probably not as significant of a chance of that being here, but good guess. And it would certainly bear looking at her labs. Her labs and her thyroid were fine, so I wasn't terribly concerned about that. So she also has brown pigments in her eyes. Not only does she have brown bits throughout her eyes, brown washes, she's also got brown freckles. Oh, Stacy, non-alcoholic fatty liver disease. Yes, 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 yes. Good job. Good job. So good. So yeah, she's got liver pigments as well. And so, and she has this white milky film along the edge here. That suggests that's a lipemic diathesis. And again, it suggests a strong risk of cholesterol that it's sedimenting in her arteries and or fermenting carbohydrates, which in my experience has always meant pushing towards type 2 diabetes as well. So we've got type 2 diabetes, and this is what her doctor came out with: type 2 diabetes, non alcoholic fatty liver, as well as all of the triglycerides, cholesterol kinds of things. So we've got a lot of stuff going on here. We started working on everything, and she knows so much about diet. She's got a lot of the training that I've got, but life has gotten in the way. Lots of stress with a husband who's got a diagnosis of two kinds of very rare forms of cancer with no prognosis of how long will he live. Lots of challenges with her adult children. And so lots and lots of stress. So her diet had totally fallen off the rails. So we worked really hard to get her diet back on the rails. She did so well. In the course of 3 months, without dieting, no starvation here, right? But just cleaning up her foods, she lost 30 pounds. Amazing. She went back to the doctor. The doctor did all the labs and went, oh my goodness, you're my poster child for what to do. She said, all of your numbers are in the normal range now, which we were so excited about. The goal here was my client wanted to avoid all the meds, right? She said, I know we can do this naturally. I'm so stressed with everything that's going on in my life. I need someone to guide me through the process. And I was happy to do that for her. She was doing really well. She did well for probably about 18 months. And then they had a super big crisis in the family with one of her grandchildren. And literally about 6 months after that, my client had a heart attack. Right. When I heard that, I just about cried. And so she survived. Thank goodness they lived just a few minutes from a hospital. Her husband knew that if they called an ambulance, it would be a 30-minute wait. But he knew he could get her there in about 3 minutes. So he loaded her into the car, took her in, and of course, she was getting care immediately because it's pretty obvious she was having a heart attack. And so and she's recovering well. But again, her diet is suffering because of all the stress, and we need to get her back on track again and just love her back into good health. So as we look at her pupil shape, we could see that her blood sugars would probably be out of balance. That would lead to triglycerides, that would lead to cholesterol, that would lead to the non-alcoholic fatty liver, and that all of that with stress could lead to a heart attack. Yeah. And so that was her story. Again, we can correct pupil shape. It takes a long time. It takes a lot of work. So we haven't seen her pupils change shape. That's just a taste of what we know about pupils. There's so much more that we know about pupils, but that's a little taste to get you thinking about, how could this enhance the work I do with my clients? So some people want to learn iridology because they want to be able to assess their clients more quickly. Some of them want to be more accurate in their assessments. Maybe they don't have access to lab tests and they need to be able to laser in a little more closely. Some people want to develop better and faster rapport with their clients, and iridology really does that for us. And, I'm going to tell you, if you do iridology properly, you can get rid of your intake form. You really can. You'll still need your release form, but you can get rid of the intake questionnaires. I've never had a client complain about not having to fill out pages and pages and pages of questionnaires. So the next go round of dynamic iridology assessment system is coming up in September. You might think that's a lot of lead time. It's giving you time to prepare. It is the only live online fully mentored course for nutritionists, herbalists, naturopaths, registered nurses, functional medicine people, anybody who's got a college level anatomy and physiology class under their belt and is working with clients or wants to work with clients. Why do you want to learn iridology? Because chances are you're spending your own time right now, unpaid, doing your client protocols. You see your client, you gather information, you go and you spend 2 or 3 hours assessing the information, putting together a protocol that you're going to bring back to their next appointment, or worse, you're going to email it to them, right? We want to stop doing that. We want to get our work done in our paid client time. We don't want to give our clients huge, lengthy reports because they can't do them. Too much information leads to paralysis. Right? They won't do it all. And we want to create programs instead that will create client compliance and success and long-term retention. I've got so many clients who've been with me for 20, 30, 40, 45 years because of how I develop my programs and how I use iridology in that program development. So the next course is starting on September 3rd, and that will be 5 till 7:30 p.m. for 20 consecutive weeks. We're going to talk about what's involved with that. But the only way you get in is if you actually talk with me. I've just posted a link in the chat box. The reason I do this is I want to make sure that you've got the A&P, and we want to make sure, you and I want to make sure that this is the right course for you. We want to make sure we can work together as well. I've had some students, some prospective students, book a call and they didn't have the A&P. You've got to have that to learn iridology at the level I want to teach it to you at. Or they had the A&P, but they didn't have a clear vision of how they wanted to use iridology, and what they were thinking was a way where it wouldn't work, and where I know it wouldn't work. From all of my years of experience, I didn't want to take their money and have them in the class and have them learn this and decide that, oh, what a waste of time and money, right? I want them to get the value they're looking for. If you don't have anatomy and physiology under your belt, let me know, and I'll connect you with the course that I send my students to, that I send my prospective students to, right? So that you can get that taken care of to join me for the September cohort. Michelle Davies came to me well trained. I asked her, why did you enroll? She already had 3 levels of iridology from another school. And she said, I wanted the latest info from an experienced practitioner that has used iridology in nutritional practice for a long time. Having my classroom at home allowed me to have all my charts and books by my side, made it easier, and having an awesome sharing and caring teacher made it the best. Judith helped me better my nutritional iridology practice. I recommend her courses for everyone. Thank you, Michelle. Lovely student. Stephanie Morgan, when I asked her, why did you enroll? She said, I'd seen enough. Oh, Stephanie, by the way, has a master's degree in education. I'd seen enough of instructors online to know you were the best teacher, the way you organize info, check for understanding, and coach students. Other instructors know their stuff, but you have the heart of a teacher. I wanted to graduate with understanding, not just knowledge. So then Stephanie posted this next comment. She just posted it on our Facebook group. I just have to praise my teacher for a minute. Those of you who know Judith from videos already recognize she's an amazing instructor. What you may not realize is that students and graduates have access to Judith and training videos and an alumni group, even after the class is finished. She's a rare find and under promise and over deliver. I'm so thankful I was led to her website. So what's included in this course? The course is taught by a 20 live, 2.5 hour long web classes. We have one class per week. I don't think teaching iridology as a 5-day intensive is an effective way to teach you all the nuances and to let you learn what you need to do. So we spread it out over 20 weeks. Every month we have 2 extra 1-hour group mentoring sessions. These are for my students and for my graduates and even for my certified graduates. Elizabeth, this is a great question. Does it work to do assessments online or is it better in person? It is always better in person because online you won't find a camera where you can't get them close enough to see their eye and do the assessment, right? And because we've talked a bit about photography and lighting, clients seem to be quite unable to get really good eye photos. And certainly your smartphone is a starting point, but it's not a great tool for getting professional eye photos. So your clients will not be able to get the photos they need to send to you. So what I recommend is you do the first appointment and 1 appointment per year in person to shoot eye photos. And then in between those years, in between the photo shoots annually, you can do online because you've got the photos, right? And then you can do Zoom, show them the photos, show them what you're talking about, and have the conversation. Does that help, Elizabeth? Does that help? Included in the course is my gift to you, a 225-page fully illustrated, full-color, digital downloadable textbook. 45 pages of cheat sheets that I've written for you. These are your Cole's notes or your Cliff's notes. Recordings of each of your class session and mentoring sessions. They're all there for you to access. That I do this specifically because 20 weeks is a long time. Something might happen where you can't attend a class. Well, I can't penalize you for that. You need access to the information, right? So you get the recording is posted in your student site. Small class sizes. I only take 10 students per class maximum. I want to make sure you've got the time to ask your questions and that we've got time to have the conversations and discussions we need. I also include a lot of one-on-one mentoring for certification preparation if you decide to certify with the IPA. And I also include a lot of invitations during your course and for several months after that to have one-on-one sessions with me if you need any extra mentoring beyond what we offer in the group mentoring. The group mentoring is so powerful though. You get to hear other people's questions, see other people's cases, and learn from their experiences as well. So, so powerful. So there we have it again. If you are a health professional, if you've got that anatomy and physiology under your belt, and you're thinking, yep, I would really like to learn more about this course, and I think I might want to enroll. That link is in your chat box again. Go to that link, you'll get more course information, and there will be an invitation on that page for you to schedule a one-on-one time to chat with me about the course, for us to look at what your credentials are, what you want in a course, how you learn best. And you will have the opportunity to even enroll right now, even though the class doesn't start till September. Why would you want to enroll right now? Because it will give you access to things like the mentoring sessions already. You can start hanging out with us. You can start asking questions. You can start getting into the community and getting to know other students and other graduates. It's so much fun and such a good thing to do, to get enrolled early so that you can really get your feet under you so that when your course starts, you can hit the ground running. All right, we talked about a lot of things tonight, about pupils, about the course. And Elizabeth, thanks for asking great questions. Anyone else have any other questions before we are done tonight? I so appreciate you making the time to be with me. If you're typing in a question, do the little raise hand icon so I know to wait for you. And if you're not, we'll be pretty much done. You are very welcome, Sharon. I hope you all have a brilliant evening. And for anyone who watches this on the replay, please remember to like it and share it, leave a comment, and subscribe to my channel. Thanks so much, and we will talk to you later. Take good care. Have a good evening. Bye for now, everyone.